Hello, everyone, and welcome to the Human Services Initiative webinar series. This is the third webinar, The Growing Involvement of Area Agencies on Aging in Community Transportation. Today is November 28th, 2023. So just a couple housekeeping. All participants are muted. The session is being recorded. Yep, the session is being recorded. All materials, including the recording, will be put on the NADTC website. Closed captioning is available. You can turn on captioning and subtitles on or off by clicking on the CC button. Please put your questions in the Q&A button. The chat is open and can be used for general comments or technical assistance. Okay, and giving the NADTC overview is Virginia Dyes, the Director of Transportation at US Aging and the co-director of the NADTC. Today's presenters are Beth Blair of US Aging and Torque Brown, President and CEO of CICOA Aging and In-Home Solutions. Passing it over to Virginia.
Sorry, everybody. Thank you, Meredith. And Meredith Bratton is our new program associate with the National Aging and Disability Transportation Center. And I personally am very grateful for her assistance today in pulling together this webinar. So I'm just going to say a few words about the NADTC for those of you who may be not quite familiar with us. We are funded by the Federal Transit Administration, and we are a partnership between US Aging, where I work, and Easter Seals. My co-director is Carrie Diamond, who works at Easter Seals. Our mission is focused on older adults, people with disabilities, caregivers, and communities. And we're all about promoting the availability of accessible transportation options that serve these populations, particularly older adults and people with disabilities. We work very closely with communities. And just a word about how we define accessible transportation. We think of transportation being accessible if people can easily find out about what transportation might be available to them in their community, whether they can find a ride that will meet their needs, and whether they're able to have a successful trip and get where they need to go when they need to be there, and get home safely. So next slide, Meredith. So like a lot of transportation, a lot of resource centers, the NADTC provides technical assistance and training. We have a toll-free line, which will show up in a few minutes on another slide. We also have an email address where you can request technical assistance or information. We have a publication list that is extensive, that's on our website, www.nadtc.org. And we have a lot of partners. We work with a number of different technical assistance centers that are funded by the Federal Transit Administration, all of whom have a role to play in transportation. We also do a community grant program, usually about once every year, maybe every year and a half. We will be doing a new community grant program in 2024, so stay tuned for that. If you want to join our mailing list, you can take a picture of the QR code on this slide, or you can go to our website and sign up to receive our e-news if you're not already getting it. I will say that one thing to know is that NADTC is in the process of conducting a provider survey. We've been That survey has been out in the field for a few weeks now. It will be closing on Thursday, November the 30th. I will, after I stop talking, put a link in the chat where you can access the survey. It's mostly multiple choice questions. And we really encourage everyone who either provides rides directly or who connects people to transportation or who contracts for transportation. So if you play one of those roles, then we'd really like to hear from you. And we hope that if you haven't already completed the survey, that you will do so. Next slide, Meredith. So I did want to say a word about the series of webinars that we've done on human services. One of those webinars we did back in June on helping people connect to vaccinations in their community, whether for COVID or for flu or for any number of things that people need to be vaccinated for. We also did a second webinar that was focused on coordination in rural areas. If you go on our website to our training resources and go to past events, you can access the recording from both of those webinars. And we hope that you'll do so. We at NADTC have a particular interest in human services transportation because we know that public transit, as great and wonderful as it is in many communities, does not and cannot meet all the needs, especially the needs that older adults and people with disabilities need to be able to travel around their communities. And so we decided to focus our efforts, particularly on those organizations that provide human services transportation. Area agencies on aging, which we're going to be talking about this afternoon. The Title VI Native American programs on Indian reservations, many of whom, the vast majority of whom, offer transportation. Centers for Independent Living, that serve people with disabilities, and many of those organizations we know are heavily invested in transportation. We know that there are a lot of human services programs out there that meet a vital need in their community. And so today, it's my pleasure to turn things over. Well, I've got one more slide, Meredith. Yeah, so this is our contact information, and we will send the slides along to everyone who is on this call, as well as an evaluation at the end of the call. And we ask you to please complete the evaluation because this is the way we know that we are meeting your needs or not. It's your way of letting us know how we did, as well as making suggestions for other topics and issues that are important to you. So with that, it's my great pleasure to turn it over to Beth Blair, who is a Senior Research Associate here at US Aging. Beth.
Great. Thank you, Virginia. So hi, everyone. My name is Beth Blair. I am, as Virginia said, Senior Research Associate at US Aging. Today, I'm going to talk a little bit about what we know about AAA transportation programs and activity from the most recent National Survey of Area Agencies on Aging. Next slide, please. So the data I'm sharing today, again, are from US Aging's most recent National Survey of Area Agencies on Aging, which goes to all the directors of the more than 600 area agencies on aging across the country. The survey, just for some background and context, is funded by the Administration for Community Living, and we work with our longstanding research partners, Scripps Gerontology Center at Miami University of Ohio, to conduct this survey, which is online. The goal of the survey is to track key important issues and topics in programs, services, and funding affecting AAAs and the older adults that they serve in their communities. Data was collected through an online survey in late 2022, and we received a 74% response rate, which is a representative sample, and really pretty great. So I don't know how many AAAs are on here today, but I'd like to thank anyone who took the survey and encouraged their peers to do so, because it really helps us out the more data we can get. Next slide, please. Okay, so today I am going to focus on transportation, but under the Older Americans Act, all AAAs provide a set of core services. Just for a little bit of background, AAAs are charged with planning, developing, funding, and implementing local systems of coordinated home and community-based services for consumers in their planning and service areas. And they do provide a core set of services, either directly through the AAA or through contracts with local providers. And they provide home delivered and congregate meals through their nutrition programs, a range of supportive services, which includes transportation, caregiver services and support, health and wellness activities, and elder rights. Next slide, please. So most AAAs, according to our survey, 91% provide transportation services. And of these, 28% are service providers themselves, and 73% contracts with local providers for transportation services. So most AAAs are working with local providers to provide these programs. Next slide, please. This slide shows more about the specific types of transportation services in 2022, which is the most recent survey, compared with 2019 when the last survey was conducted. So the first column shows 2022, the percentage of AAAs offering that service, and the right one is 2019. And you can see that the first row shows any transportation service, and that's 91%. But the most commonly provided transportation service is non-medical at 76%. And the bolded services are those that have increased substantially since 2019. So there's been 15 percentage points of increase between 2019 and 2022 in non-medical transportation provision. The next most common service is assisted transportation, 75%. That one didn't change as much over time. 60% are providing wheelchair accessible transportation, which is an increase from 53% in 2019. And 54% are providing medical transportation or non-emergency medical transportation, which is also a pretty high increase from 2019. And some less commonly provided services here are transportation information and referral assistance, and volunteer transportation. A little over a quarter of AAAs are providing transportation vouchers, which is another area where we've seen an increase since 2019. 16% have partnerships with housing sites. 12% are offering driver refresher trainings, and 12% have partnerships with rideshare companies, which again has, while still a pretty low percentage overall, has increased since 2019. Next slide, please. Okay. So we also asked AAAs in our survey about the various partnerships they have, because we know that the influence extends not just to partnerships or not just to services provided, but they work with many different types of partners to advocate and also to provide various services. So transportation agencies and providers are a very common partner for AAAs. We found that 83% of AAAs have either a formal or informal partnership with a transportation agency. We also, in this iteration of the survey, asked questions about whether partnerships expanded during the COVID-19 pandemic. And transportation agencies are one of the most common partnership types to be new or expanded as a result of the pandemic. And most of those surveys expected the partnership to continue. We also had a number of questions in this round of the survey, a lot of focus on social engagement. And so we asked AAAs which partners that they worked with to offer social engagement activities and interventions. And almost half the AAAs reported partnering with transportation providers, which was overall about the 5th most common partner type for working on social engagement. Next slide, please. This slide shows the most common funding sources that AAAs reported for their transportation programs. And you can see that Older Americans Act was the most commonly reported funding source, 87%. 59% said state government funds, 45% local government funds, 37% of AAAs have funding from fares or consumer contributions. About a quarter, a little less than a quarter, receive federal 5310 funding, 23% receive Medicaid funding, 15% have Section 5311. There's also a significant chunk of other types of funding here, and this included things like funding from public and private grants, fundraising, American Rescue Plan Act, and local levies, and a few other things. A small percentage also reported that they have funding from the federal transportation, from the Bipartisan Infrastructure Investment and Jobs Act. And then a small percentage, 2%, report having Medicare Advantage funding for their transportation. Next slide. Oh, thanks. We also asked about staff positions on our survey, and we found out that some AAAs do have staff positions that are focused on transportation. And this might not be, these can be positions that are split with another position. So this might not be a full-time person. It might be someone who splits their time between various activities. But we found that 39% of AAAs have someone who has a transportation coordinator or mobility manager role, and 10% said that they will need to hire someone to do this in the next 5 years. And then we have a very small percent of AAAs have a travel trainer, with 7% saying that they need to hire one in the next 5 years. Next slide, please. So this data is all from the National AAA Survey. We also have a chart book and toolkit that are available online at that link. And I believe you'll all be getting these slides. And I urge you to check that out to learn more about what AAAs are doing, not just in transportation, but in all kinds of things. We have a lot of data in there. We also have a number of resources related to the data in there to help share it. We have some state level data reports. We have a PowerPoint presentation and a few, we have an infographic as well. And these are all more broadly focused on everything that the AAAs do, but just wanted to let you know that that's available as well. And this also has my contact information. I'm second there. And the email for Tracy Wilson, who is our Director of Research. So thank you, everyone. And now I will turn it over to Torek.
Thank you so much, Beth, for the introduction. Good afternoon, everyone. I'm Tarek Brown, President and CEO of CICOA Aging and In-Home Solutions, located here in Indianapolis, Indiana. And it is great to be with you today to talk a little bit about our experience here in Central Indiana with transportation and what we are doing here on the ground. Next slide, please. So Indiana has 16 area agencies on aging, of which CICOA is the largest. We were founded in 1974 and serve the 8 counties of Central Indiana. Indianapolis is the largest city in Indiana with a population of about 890,000. Its boundaries are largely the same as Marion County, pictured here in the center of the state and our service area. But the entire metro area has a population of about 1.8 million. Our entire service area includes 11 cities and 22 towns, as well as rural areas. Next slide, please. Like many of you and your agencies, our client-directed services include our Aging and Disability Resource Center, Flourish Care Management, Meals and More Nutrition Services, Way to Go Transportation, a central focus of my time with you today, Safe at Home Accessibility Modifications, our Care-Aware Caregiver Support Services, and of course, volunteer opportunities. We do have additional program areas at CICOA. However, they're outside the bounds of our conversation today. Next slide, please. I want to show a quick view of our impact in fiscal year 2023. And as you look around this graphic, you'll notice the various meals, home accessibility repairs that we made. But what's of interest that I want to point out is that in FY23, we served almost 15,000 care managed clients and provided almost 19,000 trips. Next slide, please. So let's take a deeper dive into our Way to Go transportation service. Next slide, please. In Marion County, our transportation options include door-to-door transportation for those who need wheelchair access. We also operate shuttles from 32 senior living communities to go to places such as the grocery store, banks, pharmacies, etc. We provide non-emergency medical transportation for Indiana fee-for-service Medicaid members through the state's transportation broker Verita. The My Freedom program offers affordable cross-country transportation for qualifying individuals 60 years of age or older, or any person of any age with a disability, provided they have a medical verification form or an active Indigo access card. And we also fund transportation providers at county senior service corporations in each of the outlying counties that we serve in the state of Indiana. Next slide, please. Every urban area with a population of 50,000 or more, as determined by the U.S. Census, is required by federal law to have a designated metropolitan planning organization. The Indianapolis Metropolitan Planning Organization, IMPO, covers the same service area as we do at CICOA. It receives an annual allocation of federal funds and creates transportation plans, establishes regional policies, provides guidance documents, and conducts a competitive grant program that helps fund many of Central Indiana's largest transportation projects. CICOA is a member of the Transportation Advisory Committee to the Indianapolis MPO, along with Indigo and the Central Indiana Regional Transportation Authority, affectionately known as CIRTA. And together, we're working on the coordinated transportation plan to further transportation services in our region. Next slide, please. Public transportation that crosses county lines is difficult to find, yet vital for older adults and persons with disabilities who access healthcare and other services to help them live and age in community or independently. We receive federal 5307 funding as a subrecipient, which is how we operate the My Freedom program to address the gap of cross-county transportation. We also receive Section 5310 funding, which is a grant program that assists with the purchase of capital equipment and operational expenses that we use for our vehicles. Then in a previous webinar that I participated in, I talked about the need for agencies to really build out and flex and lean into their development muscle. So if you're able to connect with donors and more intentionally around transportation, that may help cover some gaps in funding that can't cross or can't be utilized together, etc. So we always have to be looking at how foundations and development arms within area agencies on aging or other CBOs that are providing transportation can really help build dollars to support those scenarios that exist where there is no funding stream to help cover the cost of crossing county lines or a longer trip than might be prior authorized to provide to someone. But a person that needs to get someplace and they don't have the ability to simply pay for it privately. So again, this piece is really important, and I want to push down on this a little bit more. At CICOA, we have the benefit of having a supporting foundation organization that has really begun driving more segmented messaging to our donors to really drive more impact into certain service areas where we know gaps exist. And transportation is one of the primary ones, right next to or right ahead of food insecurity. We know these are big challenges to face. And so while we have the benefit of those federal, state, and local resources, it just simply is not going to keep pace with the number of individuals that are going to need to get to more dialysis rides than what funding is going to pay for. That's a wonderful example that we deal with in Central Indiana. And so foundations, supporting development arms within our agencies can really be the backbone of trying to drive additional philanthropic support from private donors, corporate donors, etc., to help address some of those gaps that we know exist. Next slide, please. From the lens of advocacy, it's been very enlightening to be a part of these conversations with transportation stakeholders in Central Indiana. With a seat at the table, we can advocate from the AAA perspective to better address the transportation needs of older adults and people with disabilities. It also gives us the ability to see where we can play a part in improving the area's rapid transit system, or where we can coordinate with other partners to provide the best services. So building partnerships and collaborative opportunities is extremely crucial. One of the things that's on the current plan is looking at the scheduling and dispatching software to figure out if there's one platform that across the system at a systems level could work for all of us to help streamline communication between providers. Or if there isn't a single solution, can we build interfaces utilizing automatic plug-in technology so that systems can talk back and forth to one another? You also have to take a look at the infrastructure for clients to be able to get around their neighborhoods. There are potholes everywhere, or there are not sidewalks, or the sidewalks are not in good conditions. This all plays into the mobility of the populations we serve. I think more work could be done helping the state plan for Medicaid transportation. And I'm hoping that with our partnerships with managed care entities, as we move into managed long-term services and supports here in Indiana next July, that we can help bridge that gap. Today, the state allows Medicaid clients to have up to 20 transports a year. But as I mentioned earlier, if you're a dialysis client and travel 3 times a week minimum for dialysis, you shouldn't have to have prior authorization to get 20 additional transports a year. It only makes sense to find ways to advocate for better system level improvements that can be made. And finally, on advocacy, I'll end with, it's always very powerful to have your impact statements that demonstrate how the work you are doing is making an impact in longevity and aging in place. But what I feel is a great complement to that is having a good understanding of how that service line or business unit in your agency has contributed to the economy of the region that you operate in. This gives you much more strength from an advocacy perspective if you can talk about how those rides help save someone who was going through renal failure. And this service contributes $1.5 million to the central Indiana economy. That's a wonderful advocacy story to be able to tell. Next slide, please. And obviously with transportation, there are always challenges. One of our great challenges is still cross-county transports. There's definitely not enough funding to meet that need. There are also not enough programs available for those who fall outside the categories of senior or a client with a disability, but they still need transportation. So maybe there's a person that's 45 years old and doesn't have a disability, but needs transportation to chemotherapy or dialysis treatments. What programs can they qualify for? There's only so much funding out there, and we want to stretch those dollars as far as we can to serve as many individuals as we can. So we work together to see what resources we can connect to make the best possible experience for the client. We also face the challenge of building awareness. In our last community survey, half the respondents said they're not familiar with what resources are available to them. So lack of information remains a challenge. Another challenge is inflation. The cost of a shuttle has more than doubled in the last few years, along with increased cost in maintenance, fuel, and personnel expenses. Add to that, when Ford closes down their lines or when they have a strike, that affects us too, because we can't get replacement parts for our vehicles. We had a minivan with a side head airbag that had a problem, and it took us over 8 months to get a replacement part. The vehicle had to remain out of service that entire time. So these are some of the biggest challenges that we face. Next slide, please. The why. So I've given all the challenges, and the question is, should we be in the transportation game? And I have to say, absolutely yes. It's a much needed service, and the demand far outweighs what we have available today. The demand in our area here in central Indiana is disproportionately higher in culturally and ethnically diverse communities. So for me, it's about diversity, equity, inclusion, and belonging. It's about making a real difference in real lives. Someone is alive today because they now have access to care for life-saving dialysis treatments. Someone gets to age in place at home when they want to be and where they want to be, because they can still get a ride to the doctor's office or to the grocery store or to the pharmacy to pick up their prescriptions. Transportation is a much needed service that a lot of us take for granted, having our own personal vehicles. And without public transportation out here available for the community, people's essential needs would not be met. So yes, I absolutely believe that AAAs and other community-based organizations should continue offering transportation. I think the bigger question becomes, does your transportation service line look the same today or a year or two from now from what it has always looked like? One example of that is we've learned from surveys that we've done that our riders and our older adults really aren't that keen on mass transit shuttle rides after COVID, that they would much rather see a 1-to-1 or 1-to-2 kind of scenario. And so that has us thinking and rethinking our strategy around, is shuttles the best option, or does it make more sense to downsize to passenger vans or perhaps small SUVs to be able to continue to deliver that service based on what our client and customer wants and needs? That also would be a significant reduction in expense if that was part of your strategy or where your consumer data was leading you. Because we know that shuttle licenses, shuttles require a different level of operator's license. It's not an operator, it's more commercial. Costs to insure shuttles are much higher than if it was a minivan or a passenger van or a small SUV. And so you might save many resources through making that kind of strategic change. But I think that's the big question of the day. Will it look the same as it does today as we vision out into the future? We've got to be in a position to provide more options: buses, trains, cars, shuttles. I'm aware of some transportation programs out in Massachusetts that have built wonderful relationships with Uber, rideshare programs like Uber and Lyft as a way to help fill some gaps that they were experiencing there. And so, you know, as we think about providing more options, it's important that whatever that system is, that it's got to be viewed as affordable by those individuals that need it, that it has to be safe and crime-free and accident-free. And it has to include those rural areas that connect to the larger cities where they can be seen, have their healthcare needs addressed if it is not available, readily available in the rural communities that they live in. Finally, as successful as I think we've been here at CICOA in serving our clients, we can't provide services to everyone. That's why it's so important to have a network of partners, service providers, donors, and others. That concludes my time with you today. I want to say thank you to Virginia and NADTC for having me be a presenter here today. I hope that you are walking away today with something that maybe you didn't know before, or that you may have some questions that have been sparked up as a result of our conversation. So thank you again for your time. I will turn it back over to Meredith and Virginia.
Thanks so much, Beth and Torek. We really appreciate your words of wisdom, the information that you've shared, the experience that you shared. I think it really has been a very informative session, and I've certainly learned a lot. So we have a couple of questions in the chat. I did want to remind people that we will make these slides available to everyone, and they will be posted on our website as well as the recording of this session. So if you want to hear it again, or you want to see the slides, you certainly may do so. I also would point out that my colleague Dave Summers has posted a survey to the evaluation that we hope that you will take at the end of this session. We got a question about whether or not using volunteer drivers is something, Torek, that you all have considered as a way to expand the services in your community.
Yeah, thanks for that question, Virginia. That's a tough one because we have paid drivers at CICOA. And so if that was something that we had an interest in doing, we probably would have needed to try and start down that volunteer driver path. It's a little difficult to make that shift and try and augment paid staff positions with volunteers. I can say that the thought has been discussed at CICOA and how we might be able to leverage volunteer drivers that are doing trips and rides that maybe aren't covered through our traditional way to go service line, that would be the opportunity for us to explore at CICOA. I know that's a long-winded answer, but that's the answer I've got for that one.
Turek, I think that your caution is not unlike what other communities have experienced. Creating a volunteer driver program from scratch is a complicated process. We at NADTC have loads of information about volunteer transportation programs. We've got a number of programs that have been profiled over the years, but there's always new questions that come up in terms of liability, in terms of recruitment and retention of volunteers. We have materials that programs can use via our Every Ride Counts campaign on our website. You can actually use those materials and customize them to fit your needs to recruit volunteers if you need more volunteers in your program. So it's a very complicated business, and I applaud any community that's considering it. So next question is from Lauren Beauchamp, and I would say if anyone wants to open up their line, Meredith, do we need to open up lines to allow people to ask questions? I think we might need to do that. Is that correct?
To ask, yes. If you raise your hand, I can unmute you.
Thank you. Thanks a lot. So in the meantime, we've got a couple of questions in the chat, a couple more of them. So I'm wondering, and this is particularly why I think we might want a couple of people who are on the line to respond, whether there are AAA providers on this call that serve not just across county lines, but across state lines. And I think that has a lot to do with exactly where you're located and if you're on a state line. So if anyone has anything to add to that, or I see a hand raised from Michael Burkett. Meredith, if you can enable Michael to speak, that would be great.
Yep, Michael, you should be all set.
So Michael, you want to go ahead? Okay, we seem to be having a little difficulty with that. Anyone else have anything that they want to share on this particular issue? I have heard of some places where there is the ability to cross state lines. And I really, it depends. It's a very sticky issue. And I can say that I think we previously collected information about a program in North Carolina that is transporting people into Southern Virginia to a major medical center there. So sometimes that can happen. We can try to find out a little bit more information on this question and provide a response to all the people on this call who have registered. So I'm going to go to another question, if you all don't mind. Do you receive any funding, and this is a question for Turek, I think, from the medical providers to which you're transporting their patients, from healthcare systems, from dialysis centers, or from anyone, I guess, who works in healthcare, who is helping fund the rides that folks need?
Yeah, that's a great question. So I'll say we at CICOA, we have received funding from dialysis centers, specifically DaVita and us have a relationship for the dialysis rides. It's a great question that you asked, Daniel, and it's one that, I find myself scratching my head a lot on, because for as needed and emergent as transportation is for health systems, healthcare organizations, they are willing to reimburse, but they reimburse at a level that is just, quite frankly, doesn't make good business sense. And that's what makes the work that we do so difficult across the country, right? So, what we've tried to do is build a situation at CICOA where we would be willing to have those health system, healthcare organization relationships. And then to fill in those gaps in funding, we'd have to be leaning into our supporting foundation org to help make us whole on those transports. So I'll say, yes, we do have some of those very specific relationships. We also have relationships with PACE entities as well in Central Indiana, and are doing transportation for them also. I think a great opportunity, additional funding opportunities that exist, at least here for us, are with the health plans. As we're, as I mentioned in my presentation, as we're moving into MLTSS next July, I think transportation will open up an opportunity to be reimbursed, through the plans across their service lines, whether it's commercial, Medicaid, et cetera. So those are just a few extra organizations that maybe you didn't mention in your question that you might want to pursue connecting with and having a relationship with for your transportation line there.
Yeah, and you probably know, Daniel, who asked this question, that dialysis centers actually can fund transportation. For many years. The position of the dialysis industry was absolutely not, but there was clarity that was provided from Medicare, and they certainly may fund transportation, and at least they can contribute to it. So very important to know. I think this is an area that, as Torek mentioned, health plans are one avenue that I think many transportation providers should be considering developing close relationships with. I'd also say housing providers that serve older adults and people with disabilities. If you are serving the clients or the people who live in those kinds of buildings, like a HUD housing, then you should really explore with them how you can work together to address those transportation needs, because chances are many of the residents living in these places have transportation needs. Another question. Oh, we did get a comment from Nancy Hone. I'm sure I'm butchering your name, Nancy, so I apologize. In Northeast Texas, there is transportation provided to the VA hospital in Shreveport, Louisiana. And certainly I think a lot of VA patients are able to get that cross state lines transportation. I don't think it's necessarily well known, so it's something to really look into in your community. Other questions? I don't think I've missed anything else that's on the chat, but if you want to ask a question, please raise your hand so that Meredith can open up your line. Anything? We've still got a few minutes. So I'm going to ask this question, Beth, and I'm going to put you on the spot for just a second. I'm not remembering, and I apologize for this because I was somewhat distracted while you were making your presentation. But whether or not in that AAA survey, there's data on AAAs that actually are using volunteers. I know there's a question about transportation vouchers. It seems to me, I'm just looking at it right now, I'm sorry. There are volunteer transportation programs that are operated by AAAs, it looks like 30% of the respondents to the survey said that they were doing volunteer transportation. So there's quite a bit of knowledge out there. In 2019, the last time that data was collected, it was 29. So there hasn't been a real big sea change in this area. And I think that probably reflects the fact that it's very complicated to begin a volunteer program from scratch. I mean, of course, many AAAs already have relationships with RSVP programs and are already operating volunteer programs that serve various and sundry needs. Adding transportation does add a certain amount of complexity to it because of the liability issues that can be involved, but it's certainly worth pursuing. Other folks who have questions or comments. We've got Lori Harbison and Kenneth Bird. So in addition to Michael, Lori and Kenneth would like to ask a question or make a comment. So Meredith, can you make them available? Can you make them live?
Yep, they should be allowed to unmute now.
Okay, so whoever wants to go first.
Okay, my name is Kenneth Bird. I'm here in Kansas City, Missouri. We provide transportation to non-medical individuals with disabilities. We are in the process of trying to figure out if we can get funding to go across state line and across the county line. Was wondering, Tarek, what kind of problems do you have there in Indianapolis with crossing the county lines? I know you're not quite as close to a state line as we are, but what kind of problems do you have transporting non-medical persons with disability across the county lines?
Yeah, thanks for that question, Kenneth. Obviously, we don't cross state lines, as you mentioned. You know, the county line challenge for non-medical has always been a concern and continues to be a concern. You know, I think for me, how I try and approach those kinds of scenarios is to connect with as many of the thought leaders in that transportation sphere of influence that I can. Try and bring those folks together to really help give them a better sense and understanding of why these non-medical trips are so critical to an individual's quality and quantity of life. And I'll give you a great example. On one of our transportation surveys we did a couple years ago, we learned that our clients love the transportation services that we provided to them. But where it told me we probably needed to think about things a little different were in those social wellness kinds of rides. Trips to choir rehearsal, Bible study, right? There aren't funding mechanisms to cover those kinds of health and wellness, you know, social support types of trips. And so it was at that point that I began talking with our foundation team members and staff around really developing some health and wellness funds through our donor connections to try and address that gap. And so here we are a couple years into this, and we have been able to attract our donors who are focused on mission, who are all about, right, the warm fuzzies of what a meal does for someone or what that trip truly does for their life. And so we're able to address some of that, but not as much as I would like, Ken. And so, you know, my advice would be to continue to be at the table, forging and cultivating those relationships with the people who make the decisions to try and find an alternative or workaround to get some more of those kinds of trips funded. And I know that's a really long answer, but this is not an easy challenge right, to overcome. It's complicated and it's complex. And, you know, what I often find is at our local levels here in central Indiana, I try and keep those elected officials as close to us as I can. I feel that that helps us from the local perspective, and it gives us a little juice at the state side of things as well when we're interacting with our state elected officials as also.
All right,
All right.
thank you.
Yep.
Yeah, it's very complicated. You know, we've got a number another question in the chat I just want to throw out. I think and if you have other questions, please note them on your evaluation form. We will share those questions with our presenters, and we will try to get answers to your questions if it's unanswered. But we have someone who's asked about good methods toward building or reestablishing community trust. And I think that's an enormous question. But Torek, if anyone can answer it, you can.
Well, I'll try and get the discussion started, Virginia. Thank you. That is a monster of a question. Rebuilding trust once it's been damaged by community is a challenge. And I think you have to start by trying to gain a good sense of where the trust was broken. What was it that was done that damaged that trust and goodwill that the agency had with the community stakeholders? If you're able to identify what went wrong, and maybe it wasn't a wrong thing, it was a perception over reality thing. Those are all, you know, very valid ways that you know, damage or trust and things like that can be damaged. So, you know, I think you have to identify what that root was that damaged the trust, and then be committed to rebuild it very slowly. It's not going to happen overnight. It's going to take some time, and just be committed and laser focused on redressing whatever it was that damaged the trust, and demonstrate through actions, not just words, that you are doing what you can to get that agency and the trust and goodwill from the public back. You know, for me, I can say I've been in my role since January of 2020, was not here in Indiana. So I had no trust when I first got here. Stakeholders didn't know me. I'm coming in from Michigan. I had to work really, really hard to get in front of as many folks as I could, to really help share the vision that I brought to the table, and to really get them to understand that CICOA is an organization that they can continue, right, to trust, respect, and view as a dependable organization.
Thanks, Torek, for sharing that. And I'd say the only other thing I would suggest is that one way to establish trust is to listen to people and hear what they have to say. The good, the bad, the ugly, and make sure that you're respectful of what their experiences have been, because sometimes people have had some really dreadful transportation experiences, and it makes them very, very apprehensive about using any service. So as Torek rightly pointed out, it really takes time to overcome those kinds of things. I'm sorry that we've about run out of time. Lanice Jordan had a message in the chat that we will share with our presenters. But one of the main points that she was trying to make is this huge gap that exists in rural areas in her county and Kansas in particular, with regard to transportation, this dearth of supply. And we know that that's true. That is really an enormous issue that I know that a lot of you all are dealing with in your communities. Please keep in touch with NADTC, and be aware that when we do our grant announcement in early 2024. We're focusing like a laser on rural areas. So please be aware of that potential opportunity. And thank you, everybody, for being with us today. We truly appreciate your interest. And I want to thank Beth and Torek for terrific presentations, for sharing their knowledge and experience. And I'm sure everyone would join me in thanking you. So with that, I'll wish everybody a happy afternoon and say goodbye.
Take care, everyone.
Thank
Bye-bye.
you. Bye.